Thanks for joining us, Chairman. All right, here we go. Okay. Let's rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, I would like to welcome everyone to the August Health and Human Services meeting. The agenda before you does need a little amendment. If the truancy intervention by Judge Pollard, we're going to be kind of playing that by ear as her availability comes in, so we do wish to have that on the agenda since it wasn't on the original.
I'll move the amended agenda.
All right, any other further discussion? All in favor, please say aye. Aye. Any opposed? Thank you very much. July 1st minutes, what is your pleasure? Not all at once. All right. All in favor, please say aye. Aye. Any opposed? Brings us to our first limited public comment. And it does not look like we have any true public. Okay, so again, I will be kind of shuffling things around. If Judge Pollard comes available, she has a small time window, but we will go ahead, Martha, and get you started. Good morning.
Apologies, you do not have my report in your packet or up on the screen, I think, or do you? You do?
Real quick this morning.
Oh, thanks so much.
Is it in the packet now?
It is there. All right. So for the financial commentary, year-to-date performance is reflecting a positive operating income of just over $313,000. That's really related to how we're stabilizing and slowly growing our occupancy back after COVID and controlling our operating expenses. Year-to-date overall net income performance is just about $2.8 million. Current cash balance as of 7/31 is just over $7.6 million. Cash balance has improved primarily due to our cost settlements from prior year. During COVID, they weren't conducting Medicaid audits, so they were estimating what expenses would be. Now that they've started to audit, they're realizing those true expenses. So we're seeing an influx of cash coming in, some of which were estimates, some are now finalized. So there's still some outstanding settlements that are going to be due, which is between $2 and $3 million. But the cash should really settle in right around $4 million after that, obviously depending on expenses that the facility is realizing over the next 2 years or so. Comparing the cost settlement with the use for cash for bond payments, operations is generating cash flow of $145,000, which is approximately $16,000 a month. It's important to note, as I've already stated, that some of this cash is going to be going back to the state as they cost settle through their Medicaid audits, which we just finished one for 21, so we'll be working on 22. Year-to-date expenses have been less than revenues received, which is supporting positive revenues over expenditures. And our receivables remain consistent with prior months, which is reflecting timely billing and collections. Overall, our occupancy for fiscal year 24 year-to-date is very strong. It's right around 87.1%, so really getting to that 90 percentile, which is where we need to be to continue to perform like this. Which is much improved over prior years. As we've talked about and discussed before, through COVID, our census dropped. We took a neighborhood offline. We've since brought that neighborhood back online, and we're operating one half of that unit as a hospice unit, running about 5 beds per day. We're just opening the other side. And with long-term care, we're just seeing a huge influx of long-term care needs. So I anticipate by the end of this fiscal year, that unit will be back to full occupancy at 16 beds. So really exciting for the organization. And that, of course, is reflective of the fact that we've been able to staff. So we have CNAs, we have nurses, and quite honestly, we're at a staffing point where overtime is really limited, and sometimes sending staff home because there's certain days, I don't want to say overstaffed, but we anticipate call-ins and to ensure that our residents are receiving excellent care. Sometimes we staff a little higher on the weekends to make sure that the staffing level doesn't dip below what our quality requires. Because of that, sometimes we're actually sending staff home, and they're not getting, that, extra overtime hour. So that's also contributing to the decrease in our expenses. Commentary, really, I think I talked about this last time I was present. We have started a new LPN apprenticeship program, which is a career ladder for our CNAs. We selected 4 candidates. They have passed the required classes to start the apprenticeship program with a community college. So they will receive on-the-job training for the next year through the facility. They will attend their online nursing courses while they're working, and 9 months from now, they will become LPNs for us. So really growing our own, which is a good thing. Significant deferred building maintenance, I've talked about this previously. We are currently working and receiving bids to replace 5 HVAC units on the top. Our building also, it sounds strange to say, is aging. 2002, those units need to be replaced. So slowly over, beginning now into probably the next 2 years, many of those 12 to 14 rooftop units are going to be replaced. And then lastly, on the back of the slide or front of the slide, we are still 5-star performance in quality. That has not changed. And I think it's reflective of the wonderful care that the staff continue to provide at the facility. So, questions?
Questions for Martha? Yes, Blake.
Martha, I'm glad to hear that you're coming online with all your beds. You indicate that the long-term care is getting filled up. Is that does long-term care, does it pay for itself? Or is that one of those areas that is a cost center, or the other way around where it's an expense?
Medicaid, we actually lose per day, but the difference here is we have all this operational expense from the building and overhead costs. Since it's already there, it already exists, those open beds actually cost us more money. So if we fill those beds, we can cover the staff wages, we can cover the operational expenses. So you really have to look at your margin here and understand where you need to meet it. But generally, if you just looked at Medicaid, it always pays less than actual true expenses. Our true expenses are a little over probably $525 a day, and currently Medicaid's coming in a little over $400 a day.
So we lose money on each patient, but for the carrying costs are
That's why
being covered.
occupancy is so important, that 90th percentile, hitting that 90% census, that's where you need to meet, and we're almost there. And that's why we're starting to realize positive revenues over expenditures.
Okay, that's interesting.
So when you say that other unit is now going to be filled by the end of the year, that's how you're going to get to the 90%.
Yes, yep, we're at 87.1 now, and we're slowly working our way there. That's what we've been doing this fiscal year.
Okay, on the LPN career track, when they go to classes, is it like in skilled trades where they actually that's also part of their work hours?
Yes, yep, it's actually like the skilled trade. So this program, I think I discussed last time I presented, it is brand new. It was approved by the Department of Labor to work like a true trades apprentice program. So right on the job training, they're taking their classes while they're on site. We have a classroom for them. Oh, yeah.
Oh, what?
Yep, they'll be doing their clinicals on site. We've been approved for the Department of Labor to do that. We're one of the first nursing homes in the state of Michigan to do that.
Okay, so then they can leave class and go back to their
floor.
regular
Yep.
job that they're assigned to for the day or whatever.
Yes, so their job for the day, their on-the-job training literally is shadowing a mentor nurse on the floor. So they follow them around and learn, just like a trades program.
Oh, okay. So how long will it take them to move from being a CNA, which also had its own certification, to being actually LPN level? Do you know?
Yep, so by April, they actually start their on-the-job training this week. They have to have 2,000 hours of on-the-job training. And then there are, of course, nursing courses, and then they have to pass their NCLEX. So they'll be done with their courses in late April, take their NCLEX, and then their 2,000 hour requirement should be done by next summer. And then they'll be on the floor working for us as nurses.
Okay, because you said last time you were here too, that the feds were gonna pass something that even though we have higher standards in private nursing homes or, facilities, that, it won't affect us if that goes through with the federal regulations because of the way we already have to staff.
Yeah,
And so that LPN program is important.
It's very important. Yes, it did pass the minimum staffing standards, CMS's federal minimum staffing, it did pass. So the only, I think, I can't say concern, because we are, according to them, probably well-staffed. Their requirement to have an RN on site every shift, 24 hours a day, 7 days a week. Many times in our environment, LPNs obtain their RN and they go to the hospital. So many nursing homes have LPNs and not RNs. We have several RNs, but that doesn't say in the future that they could choose to go into the hospital setting. But managing that ratio would be the most challenging for any, and it is being challenged. So nationally, it's being challenged.
Okay, well, thank you, Martha.
Sure. Anything else?
Do you still have a waiting list for long-term care?
During COVID, it kind of waned, but it is growing now.
And this is all good news, and really congratulate you that you've maintained the standards. This is a jewel that the county has, and I'd hate to see it be anything less than that. We've talked in the past about you've projected longer term, some significant financial difficulties potentially. Are those concerns still there?
They are. So I caution everyone with a cash balance. I'm looking forward, I know it sounds ironic, to the reconciliation of our cash with the state so that they can truly take back what is their cash and we know what our true cash is so we can project into the future. It's difficult when you see that $7.6 million, like, wow, that's great. We'd even better if we could invest it and make some money off of it, but we don't. So we can't really forecast until they do all of these cost settlements and reconciliations so we know where we're at. And funding is so different. During COVID, the state didn't know how they were going to handle all these COVID expenses. The county realized it, everyone realized it, 34, 35, 40% increases, inflationary increases. So they just didn't know, and now it's all catching up with how they're cost settling. So I think I'll defer that answer until we know where cash is going to sit.
Okay, thank you.
Sure.
Very good. Thank you, Martha.
All
Appreciate
right.
your update.
Thank you.
Judge Pollard, thank you for joining us. You may approach and tell us what we need to keep.
Good to see all of you again. It's been a minute. Well, I was asked to come in and kind of give some updates, and I appreciate appearing in front of this particular committee because really what we do in the juvenile side of things is really deal with the health and welfare and services that we provide to the young people in our community. And I want to speak a little bit more broadly about some of the changes statutorily that are required of our courts, and then how I would see some of the services that have been proposed playing into that. Some of them already are. So as you may recall, last year, 19 bills passed, which will require of the juvenile court some significant changes in our processes and procedures. One of those requirements in particular is that prior to me diverting anyone, we have to do full risk screenings and mental health screenings for every young person that comes through our court. So if a complaint is filed or a petition is filed with the court, we are now required, before I even see that young person in court, to do full risk screenings and mental health screenings. So we saw this coming, And I give credit to the TIP program that we already utilize and to the CMH counselors who we utilize through that program because we sat down and had a conversation about a year ago and said, hey, we see this train coming. What are we going to do? Can you guys help us out? What do we think we can actually build into our system to be able to provide this service? Because what's important about providing these services is under the Social Welfare Act, providing these services is directly tied to the reimbursement rate that we get through Child Care Fund. So if we don't do the services, we don't get the reimbursement, which I know that we all have a vested interest in making sure that that's done well. So what we were able to do is now every Tuesday we have through the TIP CMH contract that we are millage dollars that we've used previously, they come to the court. They sit in the juvenile court all day, and they provide those screenings before a young person even hits the courtroom. So when I was over there as a referee, now as referee Price is sitting over there, before she sees a young person, she's able to see the outcome of a full risk screening tool and mental health screening tool. And that is meant to guide our assessment and what we do with that young person. So we're not shooting darts, blankly at a wall. We're seeing this person has risks in XYZ areas. We still want to divert them. We want them to be part of consent calendar, or we think they need to be on a more formal process, but these are the exact services that would be recommended, and we're able to do that from day one, which is really something that we've been able to build out through the programming, through the millage dollars that were utilized through the TIP programming and the counseling services that are provided. We're already in compliance with that particular requirement. And it's a fairly significant one, because I'll tell you, a lot of counties are really trying to figure out how to do that. I just want to put it on your radar, another one of the requirements that we haven't quite wrapped our head around, because the state itself has not quite wrapped its head around, is we will be required to employ or contract with a quality assurance specialist to make sure that what we're doing is in compliance with the statutes, but also that we're doing it at a high level. And so we are working with the controller's office. I'm actively communicating with boards at the state level, and the court has already convened a team of the prosecutor's office, the court staff, obviously Mr. Mulvaney. We're also engaging with our defense bar to try to make sure that we have a team together to make sure that we're implementing all of these strategies effectively, and that we'll be ready day one, which is October 1st. I will keep you updated as we continue to discuss what that quality assurance specialist position or contract looks like. But the state has given us limited direction, because I think they're also trying to formulate a robust set of recommendations and requirements, because this is new. I'm happy to discuss any of these particular requirements or any other dollars you're interested in discussing. Any questions you have about the legislation itself? I guess I can't really call on anybody in here. That's not my job here, is it?
You're good.
I'm going to sit on my hands.
Oh, you're fine. You're fine. Go ahead, Jeannie.
Sorry.
So we're
Forgot
gonna
where I
have
was.
to contract with another person, right? So
Maybe.
maybe, okay.
So these are the questions, right? So we've seen a couple of implementation strategies for that particular role. Some counties already employ through contracts, a specific contract through a university. So some of the counties I know have contracts with MSU, for example, where they turn over their data, they evaluate the data, and they give the data and their findings back to the county. And I've seen that be incredibly effective, because they're able to say, these kids at this risk level and this program have had this success rate. That would be incredible to have that kind of data. But those contracts are expensive. It will be reimbursable through the Child Care Fund, but those are the kinds of things we're trying to figure out. So some counties are looking at employing someone full-time as an FTE. Some people are looking at contracts with outside providers, and some are looking at modifications of current employee roles to include that quality assurance piece.
I know some of the smaller counties really just are struggling with trying to keep up with all these new changes, but in several aspects of county operations. So
That's right.
I was wondering how they, are succeeding.
Within the statute, if you receive the basic grant, so if you have $75,000 or fewer people within your county, you're not required to employ the quality assurance specialist, SCAO, the Supreme Court's administrative office. They will be doing that for the smallest of counties. Because we don't have less than 75,000 people, because we do receive the CCF larger reimbursement, we are required to comply with those 5 main requirements under the Social Welfare Act.
So, and just to be clear, everybody hop in and correct me if I'm wrong, but what we ideally are looked at to do right now is to, since we had our juvenile justice meeting, if you will, and we decided to not take any action, we're dealing with the TIP program and possibly additional funds beyond that. But the TIP program is what we're being guided to address right now, correct?
Correct.
Okay.
And that would be my recommendation is, whatever mechanism we are able to utilize to continue with that program, as well as the components with regard to the counseling that are attached to the TIP program. We're using those services very actively, and in fact, they're already allowing us to be in compliance with the future requirements under the statute. So it would be my recommendation in whatever mechanism we're able to continue on with those programs. And you all have heard Harriet and her team come in and talk actively about the truancy intervention program. The numbers that we have are she's actively diverting probably 3/4 of the young people that she has on her caseload from any kind of formal intervention by the court, which is an extraordinary number to be able to fully divert our truant youth and get them services before they have to enter the front door of a court. I think very few programs are able to, for the years that she's done it, demonstrate that kind of efficacy in their programming.
You're not only recommending the TIP program, you're recommending the program with CEI.
Correct.
Yes.
At least one of them, I think they had 2 programs.
Yeah, they're both TIP programs.
We have a RESA TIP program and a CEI TIP program.
Correct.
Which one are we talking about? Both?
Both.
That's both. I'm sorry if that's not clear.
That was what my goal here was, to get us to understand on our what we deal with, what is being asked of us, so.
It is my recommendation, and again, I can speak, if you would like, I can certainly come and give updates to this body more frequently if it's helpful. We're used to speaking the language that we use and
You're
talking
good.
about that stuff over there, so I appreciate the clarification.
You're good. Any other questions for Judge Pollard? All right. Yes.
For the evaluation for the young people, do you do that on the spot just before they come into your courtroom, or is there something that takes place weeks earlier for these people? How does this actually work?
Well, and this is new. So what we've figured out works best is to try to, the more statistics show, at least the research that we have shows that when you have low-risk kids, the more interactions they have with the court, physically or in person or by Zoom, the poorer they do. If you have more interventions for a low-risk kid, you're actually potentially harming their progress. And so what we attempted to do was to have sort of a one-stop shop. You got one court hearing, come in person, we'll have the evaluation done, you'll meet with the referee, we'll figure out if you can go and be diverted from the programming, and if not, you may come back, but usually we'll do those things by Zoom to try to have fewer interactions with the physical court. Having kids appear by Zoom at school, for example, so that they don't have to interrupt their school day to come in. Parents can appear from work so they're not interrupting their work day. So yes, we do the evaluations best practice, or at least in the best case scenario where the kids are actually in the court just that one time before they go in. And obviously, these counselors are great at what they do, and so they're able to assess, is this typical stress response, or is this stress related to having to be in a courtroom and that being a stressful scenario anyway? So we're taking all of those pieces into account when we can.
Okay, that makes sense.
Yeah.
Any other questions at this time? I know Judge Pollard has to get back, so.
Sorry, I got a docket, guys.
You're good.
Thank you.
All right, thank you for coming, appreciate it. So to be clear, we are being asked to consider this. If there's any further discussion on this, you can entertain a motion. It's up to the committee at this point, but we are dealing with a statutory issue.
Well, I would move that we utilize the juvenile justice millage money and grant the request that those two programs made previously that we essentially,
Didn't
I
fund.
guess,
Yeah.
ignored for the moment or put on hold. But I would move that we fund those two programs at their request.
Is there a second? Support. All right. Further discussion. Again, this is to fund both TIP programs for the coming year. All in favor, please say aye.
Aye.
Any opposed? All right, very good. Thank you so much.
So where does that put the other programs? Okay.
Right now, they're not funded.
Yep, I know. Just throwing it out there. I understand.
All right. We did that. Martha's.
Collard changed my mind.
Strategic plan, substance use and misuse.
Just a quick update for everybody on that. The Health Department is done with their portion of the strategic plan, and Amy Dolinky from MAC and MSU are working on finishing up the final piece of that, which should be completed by your next meeting. So in September, we should have a full plan back for you to review.
Very good. Yes, Blake.
And I would add, we're kind of talking about having a committee to look at determining how to use some of the funds. Is that right? I mean, kind of like we do with the parks millage funding. And we haven't fleshed it out entirely, but essentially, we would look at a couple of members from the community, a couple of members from this board, and we would send out RFPs, and basically, it would be sort of a longer-term strategy. We're still fleshing this out, but, you know, you might look at 3-year funding. So you don't have this stop and start thing, but you've got a little longer term. We've got X amount of money for 3 years, and we've got some people that are asking for it. We've got some citizens and some electeds that will determine where that funding would go. And so that's sort of the direction that we've been talking, so. Which is all in best practices, and it really is the culmination of having all of this report and this strategic plan, so.
Very good. Brings us to miscellaneous.
None?
And last chance for limited public comment. Logan? No? All right, he's gonna pass. All right, thank you very much, everyone. We are adjourned.